there have been no provisions to fund the distribution to Black, brown, poor, and rural communities. No public education effort, no outreach effort, and no supplemental distribution effort. It's not going to be as easy as saying, go to your local national drug chain and you can get the vaccine. A lot of places don't have the same access to healthcare facilities. That's what caused the disparity in the death rate to begin with. You want to hear something frightening and something that should trouble everyone? Death rate from COVID was twice as high in the Black community than the white community. 2 times more Blacks died than whites from COVID. 1.5 times more browns died from COVID than whites. Look at that disparity. Why? More Blacks, browns, and poor people had underlying health conditions because there are health disparities in this nation. 1.7 times more likely to have diabetes, 1.4 times more likely to have hypertension, 1.3 times more likely to have an obesity issue, 3 times more likely to have asthma. Why? Because they don't have the same access to health care. And now we're going to go to that same health care apparatus to do the vaccinations after you know that it is uneven and discriminatory in this nation? It makes no sense. There are just fewer healthcare private facilities in Black, brown, poor, and rural communities. That's why they have more underlying conditions. That's why you have twice the death rate in the Black community. So you have to recognize the mistake and the injustice, especially when it comes to the vaccine. If you're going to prioritize the vaccine, shouldn't you be prioritizing it for the communities that have the higher death rate? Majority of Black zip codes, 67% more likely to have a shortage of primary care doctors. This is a social justice and racial justice and economic justice issue. The NAACP, any introduction of a vaccine plan devoid of the infrastructure we know is effective within the Black community reinforces the same incompetence that has affected so many thus far. Urban League, Mayor Mark Morial. The current administration's plan is thoughtless, careless, and needs to be taken back to the drawing board. So, this vaccine is not tomorrow and is not as easy as we think, and it has to be done fairly and equitably. And it has to correct for the mistakes that we have made so far.